a huge accomplishment that a small critical access hospital in Minnesota would be one of our first hospitals in Minnesota and North Dakota to achieve meaningful use. So we want to celebrate today and really understand what a big accomplishment this is. KHA and REACH program is the Minnesota and North Dakota Regional Extension Center. We're in partnership with the College of St. Scholastica and the National Rural Health Resource Center, and I represent Stratus Health. I want to introduce a few folks who will be participating today. First, Dr. Paul Kleber. Hi. Sarah Tupper, who's been the Health IT coordinator here with Glacial Ridge. Nick, who is coming from Chicago Regional Office from CMS. And Kirk, the CEO of Glacial Ridge. And Katie, the lead for the team here at Glacial Ridge. In addition, we have some vendors, the vendor helpline here. If you want to introduce yourselves.
I'm Brent, I'm the client executive with Healthline.
Anna Toole, I'm the client manager with Healthline.
Dale Arndt, I'm the client manager with Healthline.
And we have Mark from the Minnesota Hospital Association. And Marty LaVenture from the Minnesota Department of Health. We have two other members of the Minnesota Department of Health, somewhere close to Glenwood at this moment, we hope. They need to be here in 20 minutes. So hopefully they will be arriving shortly. I've had the privilege of working with Glacial Ridge in the past. They were part of our doctor's office quality IT project. I noticed right away that they had what we call the trifecta. They had strong leadership, they had a really engaged team, they had clinical leadership that was engaged with the process, and they were very, I bet you that's them. They were very purposeful about making this journey. Nothing was left to chance. They really planned everything out, knew where they were headed, and were very goal-minded. So it sounds like they've arrived. So achieving meaningful use first in our states wasn't a surprise. We knew that they had their act together and they were moving through to meaningful use. So I'm going to have Dr. Kleber say a few words.
Well, good morning. One of the things that Sue has asked me to talk about today is, well, why are we doing this meaningful use thing? Okay, really. Well, if you think about it, for the longest time, medicine has been depending upon paper charts, upon information that's locked in a room someplace. And we really, in order to judge quality, in order to know what we're doing, we really have to have access to that information. So some time ago, in order to bring this country back on its feet again, this Recovery Act was passed, and one of the things that was put in it was a great deal of funds to move medicine into what we say the 21st century, out of quill and parchment, but using technology that really helps to share and allow us to measure what we're doing and see how we're doing. And so that's why we're here, that's why this push, that's why there are incentive dollars to hospitals and providers to adopt meaningful use. And that's why a number of programs are created in order to support folks like yourself to achieve meaningful use. Like the Extension Center program, like the workforce training program that will bring people who are able to help and assist you in maintaining your EHR, as well as the money for exchange, so that now that we have these systems, we're actually able to exchange the information from one place to another. So I've had some of the opportunity to meet with some of you folks, so I think it was about 2 years ago, and I can say you have done an amazingly wonderful job of helping this vision take place in your community, and I want to congratulate you. So I think you've done a job very well done, and more places will be learning from the work that you've done and how they can move forward.
We're going to just pause and introduce Ann Schlegel and Karen Welly. If you want to wave to
I'm driving around literally in the fog.
And I feel to introduce our architect of today's event, Sally Buck, the person behind the camera back there. So Sally's from the National Rural Health Resource Center. So at this time, we're fortunate to have Nick Blake from CMS Region 5, that's the Chicago Regional Office. Nick is also the project officer for the Medicaid program in Minnesota. So I had the privilege of meeting Nick not so long ago at a site visit. So Nick?
Okay. All right. got my messy paper notes and they going paper free. So I don't have an iPad yet. I'm waiting for the iPad 3 to come out. But I'll get the iPad 2. Okay, so my name is Nick Blake. I'm a Health Information Technology Coordinator at CMS. My job is to work with states in the development of the Medicaid EHR incentive program. I work with 13 states, and I consider myself lucky enough to include Minnesota in that list of 13. Through my job at CMS, I have the opportunity to travel a lot. I've really been from anywhere from Boston to Los Angeles, and people ask me what's my favorite place, and I can say quite honestly, this is my favorite destination. It's my third time in the Minnesota, Minneapolis, St. Paul area. We're a little bit further away from that. And granted, I've never been here in February, so that actually might change a little bit when I come back. But I am originally from the Upper Peninsula of Michigan, so I'm used to snow. And then I don't need to say this probably, but just in the interest of full disclosure, I am actually a Green Bay Packers fan. So, but really, that validates my feelings for this area. I mean, I still like this one, right? So, anyways, all that aside, the real reason why we're here today, I want to congratulate Glacial Ridge as well as the REACH REC in this substantial accomplishment in achieving meaningful use. This really marks a significant moment for this hospital as well as healthcare in the community, and it shows a commitment by both Glacial Ridge and the REC for improving care. So really, why are we here? Adopting and using EHR certainly is not easy. I'm sure anyone in this room can attest to that. So why are we doing it, and why are we making such a big deal out of it? Well, simply put, our healthcare system right now in America is unsustainable. It's extremely expensive, it's inefficient, and it's not quality focused, as it should at least. Among industrialized nations, the United States is 37th in health outcomes. I think it's about 190 industrialized nations, and the US is 37th, and we're #1 in costs. So costs are increasing, and outcomes are not improving, and we're simply just too great of a country for that to be acceptable. So at the federal level, CMS is working on remedying this problem in what our triple aim, which is to improve the outcomes of our populations, Medicare and Medicaid, improve healthcare, and reduce costs. So we have many different incentives, many different initiatives that are working to be able to achieve these goals. We have affordable care organizations which are going to place a focus on quality and performance rather than just service. We have insurance exchanges that are being developed. We have e-prescribe initiatives. We have health information exchanges, and of course now we have the EHR incentive program. In order to be able to achieve the triple aim, in order to be able to achieve our goals, and in order to be able to improve healthcare in the future, we simply have to move away from paper. This program is not about saving trees. It's bigger than that. I don't have anything against paper. In fact, I come from a small town in the Upper Peninsula of Michigan, Escanaba, maybe some of you are familiar with it even. And it's essentially the whole town is employed by a paper mill. So I like paper just fine. But the cold hard reality is that it's inefficient and it's limited in its ability. And in the context of healthcare, and with the stakes of healthcare, it's just, there's no excuse not to be able to take advantage of the technology that's available to us now and be able to improve the way our systems work. So what we want to do is we want to take health information and we want to put it into an electronic structured format where we can have data that we can actually use for multiple different reasons. We can have data that will be able to follow patients, whether they move across the city or they move across the state or even across the country through health information exchanges. We want to make information available to providers at the point of care so they can improve their clinical decision making at the point of care. And then we want to be able to have patients be informed as consumers of healthcare. Ultimately, the primary consumer or the only consumer of healthcare is a patient. And in order for a market to be able to operate efficiently, those patients and those consumers have to be able to make informed decisions. And we simply can't do that right now with the system in place with paper. And then finally, we want to be able to reduce costs. There are administrative inefficiencies with paper and other costs that are just unnecessary. So the need for EHRs is not new, and the demand for EHRs is certainly something that's not new. I've heard from hospital CIOs that have told me that they identified the need in their hospitals for electronic health records as far back as the early 1990s. So the question is, why haven't we been able to make this move and have widespread adoption of electronic health records? And the answer is that there are many challenges and many barriers. Cost is certainly an impediment. These are not cheap systems. They require a lot of technical assistance. The EHR is going to touch pretty much anyone in a practice or in a hospital, whether you work in IT, whether you're a doctor, whether you're a nurse, whether you're a manager, whether you do claims billing, it doesn't matter, you're going to be affected. So there's a need for training. And then there's also workflow. So we've had systems in place that were based on a paper-based system for years and years and years, and now to be able to move away from that and something totally new is a dramatic change, and it requires workflow readjustment. So in order to be able to overcome these barriers, we have funded, through the federal government, we have funded regional extension centers like REACH, who provide technical assistance, training, workflow to hospitals, critical access hospitals, and providers and individual practices to be able to overcome these challenges and to be able to implement EHRs, ultimately use EHRs, and then finally be able to achieve our healthcare goals through the triple aim. REACH has done a fantastic job, just an amazing job. I've had the opportunity to speak with them on a few occasions, and I have the opportunity to speak with regional extension centers all throughout the country. And they have one of the most ambitious goals I've seen so far as recruitment and then meaningful use achievement. And they're well on their way. I think they have 3,000 providers right now, as well as hospitals that have been recruited. Is that correct?
Yeah.
That's an amazing number. There's states equivalent to Minnesota that have 1,600, 1,500 as a goal. So they've done a fantastic job. And so with help of the regional extension centers like REACH, we're going to be able to move past the barriers and be able to achieve our goals. So just really quick, currently where are we at with the EHR incentive program? Right now we are 10 months into what is going to be a 10-year-long program. And in Medicare we have around 80,000, actually it's close to 90,000 eligible professionals and hospitals that have applied for the program, registered. And then in Medicaid we have about 24,000. In Medicare we've paid $350 million worth of incentive payments. And in Medicaid we've paid $514 million worth of incentive payments. So we're almost getting close to the $1 billion mark. And like I said, we're 10 months into what is going to be a 10-year-long program. So that's a testament to a few different things. One, the money involved in this program, it's substantial. There's a lot of money, it's available. Another is the enthusiasm and the support and the adoption among providers and hospitals to actually take the leap, adopt electronic health records, and then use them in a meaningful way. And then, of course, the hard work, whether it's at the federal level, the state level, administering the programs, or whether it's an REC helping providers and hospitals be able to adopt EHRs and use them. So really right now we stand on the precipice of what is, without hyperbole, a paradigm shift in healthcare. And providers and hospitals like Glacial Ridge, along with the support of RECs like REACH, have made a commitment to improve care now and as well as shape healthcare in the future. So it's not going to be easy. It certainly wasn't easy, I'm sure, and there's going to be moments of adversity, there's certainly going to be challenges, and like so many other things in life, really, sometimes in order to get better, things have to become difficult first. So if you just stay the course, continue to work hard, quality is going to improve, costs are going to be reduced, and ultimately everyone in the country is going to be able to reap the benefits. So thank you to everyone for your hard work. Keep up the good work, keep fighting the good fight, and congratulations. So I want to do a round of applause for all the questions.
Yeah, are there any questions for Nick while we have him here? Go ahead and cover him with questions around meaningful use.
Anything? When meaningful use is going to come out, stage 2?
Yeah.
Sure. Okay, so we have our we have our final rule. Actually, it won't be the final rule. It'll be the national proposed rulemaking on stage 2, which is going to come out in January of 2012, and then we'll have a 90-day public comment period for you to be able to submit comments, and then we'll address those, and then ultimately shape how we're going to put the final rule together. And I really encourage everyone to read the rule. I'm sure it's not going to be short, and it's not going to be easy to read, but your opportunity for that 90 days for public comments is really important. And it really, we have to take all of them seriously, and we have to read everything, and we address them and is really going to shape how we're going to develop our regulations in the future for meaningful use. So I really encourage everyone to look into that.
And will it be that proposed rule when stage 2 starts?
Yes, so we have, I'm sure you've heard rumors where there was a recommendation to push meaningful use stage 2 back into 2014. And what that is we've had we have a health information technology advisory committee, and they made a recommendation to the Office of the National Coordinator to push meaningful use back, and so we're addressing that in the NPRM, and it's going to be available for public comment, and then after we receive the comments, then we'll have our official date for when meaningful use stage 2 will come out. Anything else? All right.
Well, he's available afterwards if you want to have more questions privately. Thank you so much.
We can talk football too.
Sorry, we did not know he was going to make that fan when we asked him to go.
Thanks, everyone.
I'll talk over football with you.
Sure.
Next, we have Marty LaVenture. Marty is the director of the Minnesota Department of Health Office of Health Information Technology, or OHIT. Marty's also the leader who leads our Minnesota eHealth initiative. He's been such a strong visionary leader for us in the state, forming the public-private partnership of the Minnesota Health Information, or Health eHealth initiative, which we all come together around and move health IT initiatives in the state since 2004. So Marty?
Thank you, Sue. Excuse me for the kind words, and congratulations to all of you. I'm honored and pleased to join you in this celebration today. Exciting milestone. I think that's very important, and I have to start with one of Dr. Kleberg's great slides at, I think, one of the work groups, when he helped us try to explain meaningful use early on, and he had a little picture up here, and it showed a pumpkin. And then the other side of the picture was a pumpkin pie. And he said, that's meaningful use of a pumpkin. And it's always stuck with us as a nice tangible view of how do we get to meaningful use. And it I think represents not only a sort of a visual for us, but a great opportunity to talk about the many factors that go into a milestone that you have all achieved. And it's, you know, we talk about the technology, but it's all about the people and all about you and your achievement that has come about through in really a number of aspects. Certainly the leadership, we look at Kirk and Heidi and the board and the medical leadership that is crucial to make any organizational change like implementation of electronic health records go forward. That's very important. The committees, the work groups, the staff, from the nurses to right to the receptionists that have to change their practice in order to make all of this work. And why do we do it? For the vision established in Minnesota by the eHealth Advisory Committee in 2004. It said the purpose of implementing electronic health records, not the technology as an end, but it's a vision for improved care, improved quality of care, to improve safety and improve the health of all the citizens of our community. And I think that broad vision is what it remains today an important goal. This is a milestone along that particular goal, and a very, I think, both noble and an important one for all of us to keep in mind. There's a little model that the Health Advisory Committee uses. It divides this whole sort of view and large vision into three parts. It says we need to adopt the technology in various stages through we're working closely with the vendors and others. We need to use it in an effective way, and we need to make sure that we can exchange that information with our partners. And that model is, I think, still a very important one to keep in mind, that as much as implementing the technology, it's really how do we improve it every day, a continuous quality improvement process for decision support. How do we get the best practices engaged into practice? How do we make sure the order entry and e-prescribing, so the accidents that we've heard about that are continuing with the paper use of records and the problems with the writing can be avoided, and that we can continue to provide strong and effective care in our community. And then how do we really follow, I think, really the words were expressed well by Dr. David Blumenthal, the former director of the Office of the National Coordinator in Washington, when he talked about health information, and our goal is to really move that information seamlessly with and around the individual. We have many of you, especially probably many, for me, many of my kids, are very mobile driven these days. They have a smartphone, and they have by the time they hop in the car from a clinic visit, they've already gotten a little vibration because they have an email showing their lab results from the hospital or the clinic. That's the way they want to consume that kind of information. They want to see it that way, deliver it, send a note back to their clinician. That information is beginning to flow more seamlessly and hopefully moving towards a bidirectional communication with the individuals in the community, and particularly with patients. It's a level of expectation, puts a challenge on all of us to not only just install software or technology, but to use it really effectively and to move ahead and change those times. And that's, I think, our great challenge moving forward, is how do we move to that next step of not only meaningful use, but the Health Advisory Committee has talked about how do we really engage the community. They've actually identified more than 20 different domains: long-term care, public health, laboratories, specialty groups, all of those that are maybe involved in the care of a particular individual, and how do we move that information seamlessly among them. And the hospital is really the core. I always have a special place in the heart, in my heart, for a small town, relatively community hospital. I grew up in a town of about 2,000, and I was actually the first one in our family born in a hospital. 9 other children were born before me, and there was no hospital there. And that hospital became not only a place for the happiness of delivery and the improvement of care, but the leaders and the staff that were represented workers at that hospital were very important people in the community, important leaders directly related to care, and also innovators. And I encourage you to continue to use the leadership you brought together for this milestone, and to continue to use the work groups, the teams that you put together to challenge yourselves to this next stage, moving mobile, connecting within the community, and to continue that leadership that you bring to the community-wide in this wonderful county and the wonderful community that you have. Statewide, there are 78 community access hospitals, I believe. Is that right? I think so. About 129 or so hospitals statewide. And those you have risen to be the first among those, and for the meaningful use, and I think that's a wonderful achievement. Minnesota is leading the nation in terms of the adoption of technology. You are leaders in Minnesota, and I think it's wonderful to pause and to be proud of this important milestone as you look forward. Had the great opportunity to hike in the mountains a few years ago, and we were hiking towards this Mount Robson in the Canadian Rockies. Some of you are familiar with a very large mountain. And hiking and hiking, it felt like forever and ever to get there. And it didn't seem like we were getting any closer to the mountain. And then up on this ridge, we all stopped, put our packs down, and turned around and took a look across the Sunshine Meadows Valley, and saw these tiny people way in the distance that were just starting out where we had been. And that it's great to pause and reflect on the progress that has been made, and I think that's very important. But still turn and keep your eye on really the larger picture as well. And I hope you all feel as proud about this achievement as we all do about you achieving it. I hope that on behalf of the State Health Department and on behalf of the eHealth Initiative, we are grateful for the work that you're doing in your community, because that's really where the work gets done in Minnesota, as you know. and it really gets done as it relates to the care of individuals. So we're excited to hear about your next challenges and your next opportunities, and as you and learn about your lessons learned, and encourage you to share them. As you know, each June we have a summit, an eHealth summit, that highlights many of the stories in Minnesota and the lessons learned. And the most popular ones every year are stories like yours that tell the story of what's really happening at the community level, because they understand the reality and the struggles that sometimes it takes to make organizational change and to get the commitment of everyone to maybe do things a little bit differently than we have in the past. And we encourage you to continue to share your story with others through the hospital association. Certainly we'd love to have it through the Department of Health and our communications as well. And because I think it's an important story and lessons learned. That's the broader community of Minnesota that I think you have a lot to share, and we need to learn, I think, from you all the lessons that you have gained and hard-earned over these past few years. So thank you again for the opportunity to be here and to celebrate with you and to share a few words with you today. Thank you very much.
Next we're going to have from the Minnesota Department of Health, Office of Rural Health and Primary Care, Karen Lilly, who's the Assistant Director, and Angela Gold, who is the Project Consultant for eHealth in the Electronic Health Record Loan Program.
Hi, congratulations, and greetings from Mark Schoenbaum, Director in the Office of Rural Health and Primary Care. Glacial Ridge has a lot to be proud of and is an example of the hospitals that we have all over Minnesota that use, personal connection and deliver the best care really to their patients. I actually grew up in Melrose, just a little stone's throw down the way, and my mother was in that hospital for a long time, and it's just the personal care that comes from here it can't be equaled really in any of the big facilities down in the Twin Cities. And when you take the innovation that you've done around emergency medical services and the training that you've done and the collaboration that you've done within your hospital and within your community and with your neighboring cities in New Stephen County, and taking all of that and taking all of the resources that you've been able to access, grant funding through the eHealth grant program. I don't know which one of you worked with Ann on that, but being able to leverage with your fellow communities, and really, you're like a perfect example of why public investment, such as the Critical Access Hospital Program and with the grant programs that we no longer now have in Minnesota, but what taking a bit of investment with a bunch of innovative people who work together can really do, and then bring in the kind of incentive that you're going to be bringing in with the meaningful use incentive. So congratulations. That's all I want to say. Yeah, and maybe Ann can just tell you about a new opportunity that's just coming up.
Well, and as a reflection of, I think we need to acknowledge that here in Minnesota, not only what Glacial Ridge has done in terms of partnership with their communities and other hospitals and clinics and whatnot, is the great partnership and collaborations that we have throughout Minnesota, including with REACH and Stratus and other offices at the Minnesota Department of Health that create some of these, as well as federal partnerships, create opportunities. And the one that was just announced last week through the Minnesota Department of Health is a new grant opportunity for health information exchange. So using some of the funds from the federal ONC program for health information exchange to help our critical access hospitals and other healthcare providers throughout the state take that, not only the step to get to meaningful use, which Glacial Ridge has already achieved, but even beyond that. So
we're excited about that. If you have any questions, see Ann later. It's a neat opportunity, and we're working with Marty's office on rolling that program out. It's brand new. So congratulations, Bert.
Thank you. And next we have the story of Glacial Ridge Health System through the eyes of Sarah Tucker, the health IT consultant for Glacial.
And I don't know why I get to share this great story. I didn't want to. They're very humble. Everyone's very humble group, so I get the pleasure of telling the Glacial Ridge story. And there was another consultant, another REACH consultant assigned prior to myself. So I just came on board with Heidi and working closely with Leslie back in February, March timeframe. So they've filled me in on a lot of the story, believe me. Just a little bit of background for the folks who don't know Glacial Ridge quite as well as the folks who work here or those of us from REACH. They're an independent, not-for-profit, 19-bed critical access hospital. The hospital became certified as a trauma level 4 hospital in 2008. They were licensed as a critical access hospital in 2005. And they also have a medical clinic that's just attached physically here as well as their critical access hospital. Back in fiscal year 09, they had almost 13,000 outpatient visits, 741 admits, and average daily census was running around 8.1. Is that about what it is today, or are you guys up a little bit starting flu season now? Is that about what it is today? 8.1? It's up from that? Okay. And my heart is also in the rural setting. I grew up on a farm down in southwestern Minnesota and actually practiced. My first nursing job was at the bedside back down in Worthington. And so starting IVs on your friends' parents and your aunts and uncles is a little different than being in the Twin Cities starting IVs on people that you don't really know. So I understand that connection very, very clearly. One of the slides that Heidi likes to share when she speaks is, she says when times get tough, you here at Glacial Ridge really come back to the thought that we're not just implementing technology to make everybody uncomfortable and stress your day more. We're doing that really for the quality of patient care here. So when things get tough, we remember that it's for the quality of patient care. Asking Heidi and the gang here, what are your keys to success? I'm just going to name off some of the things that they feel have helped them to be successful. And the first thing is the positive attitude around here. And Heidi says that trickles from the very top, the CEO and the board, all the way down to the bedside. And she laughs and tells me, you know, you can hire folks for any kind of skill. We can teach you how to do that, but we can't teach you attitude. So we really need to hire folks with a good attitude. Helps out a lot. They also have a history of partnering with other folks. They have an internal HIT squad here, Health Information Technology Squad, that's really helped to implement a lot of the work. They've partnered with Stratus Health, as you heard. They've got a long history of that, and now recently with the REACH team to get the work done. They also have a very strong partner in Healthland, their electronic health record provider. They participate frequently in regional user groups, so both from the Minnesota perspective, their electronic health record perspective, and then the REACH perspective as well. They do a lot of coaching, a lot of fielding of calls from other Healthline users as well as other folks who have questions for meaningful use and what that means in a small organization. So they're just a wealth of information here and they're very willing to share it. They also have in place a clinical steering committee which is made up of about 20 plus folks. So it's department managers and then the super users who participate in that as well. So giving that bedside input to what's happening. And then they also formed a meaningful use subcommittee. They felt like that was really a key to their success. And what they did with the meaningful use subcommittee was they put together kind of a matrix of all of the various objectives and measures for meaningful use. They even color-coded it. The core objectives are yellow. And so at each one of their meetings, they would talk about, you know, here's this particular objective. Here's the Healthline module that's helping us meet this measure. Here's the actual measure, what percentage or yes, no we need to be at. And then here's the status where we're at with that. So along with the core objectives, there was a menu objective spreadsheet that they worked off of. And then also the clinical quality measures that they were working on. So just that idea of tracking and communicating and having many people involved from bedside to leadership. Another thing, key to success was communication. So they had EMR project binders on each department. They put out a monthly newsletter. Is that still happening? You guys still doing the monthly newsletter? And oftentimes Heidi would share that with me. And it's really great. It gives kind of the big picture of the industry and then brings it actually down to what's happening here at Glacial. So it's a great newsletter. They would send out email notifications with tips and tricks for using their electronic health record to meet those meaningful use measures. They had posters and banners hung around here. They also did some process mapping, and Leslie sounds like was very instrumental in that. She sat down with a physician and then a nurse and would walk through all of the processes and kind of like, here's our paper process, here's where we're hoping to be, and here's where we actually are today. So mapping out where we want to get to this state. And then they tell me they've revisited those workflows 25 plus times between starting and now where they're at today. So that's the key, is to keep updating those processes to what is actually happening in the clinical setting today. Here's what we thought would happen, but here's what's actually happening. We all know there's usually a pretty big difference there. So again, they were using the meaningful use. They had timelines that they really stuck to, and then the meaningful use matrix that I just pointed out. Leslie also got together with one of the unit coordinators. Was that you? It was you! And put together a really great checklist to help the nurses on the unit be able to check through and make sure that they were populating the electronic health record with the items that they needed to in order to meet meaningful use. I think that's such a great example, again, of partnering. A unit coordinator and then Leslie as the sort of the software guru. And so the way this worked, from my understanding, is they would pass a sheet out to each nurse who had a patient that day, and the charge nurse would check in with them part of the way through the shift, see how things were going on the checklist, and then again at the end of the shift. And any coaching happened right there at the time, which is, again, a key thing. If you can catch folks right as they're not filling something in, or maybe they filled something in not quite right, and correct that, that certainly helps the future behavior. Another thing Leslie did is she put together some sort of step-by-step process for the providers. So not a checklist, but a provider kind of step through of the steps that they needed to do in the electronic health record as well. Some supporting roles that they felt really led to their success. They have a clinical systems coordinator, who's Leslie, and they feel like just having that one point of contact for all of the staff knew that Leslie's kind of the software guru here. She knows the system inside and out. She set it up. She programmed the reports, so she's the one who really understands it intimately. So even when someone would ask her a question, you know, what's the rationale for us needing to do height and weight? That doesn't make sense to me. I don't want to do that. Heidi knew, or Leslie knew the rationale behind that, so she could speak to that. They also are doing a lot with their super users. I think sometimes the temptation is once the go live, the heat of the go live is done, you discharge your super users. Thanks a lot, it was great. We'll call you up when we have another go live. But what's a better idea is to keep them engaged so that the next time you have another big initiative or another big go live coming up, they've been involved all along the process and they can just step right in and help with that. So they do a great job of continuing that engagement. Another key to success was adoption by providers. And Heidi tells me they were lucky here, that the providers were actually pretty easy to work with. They did engage Dr. Kleberg early on. He came and spoke with some of their providers. And Heidi tells me that another trick that really worked was to engage their curmudgeon early on. You guys are all smiling out there, you may know who that is. Engage them early on so that they can't complain later, is what Heidi tells me. But they feel a part of that process. So again, that's another great key to success. Having plenty of resources and education for folks to go to if they need it. Leveraging and utilizing Stratus and Reach, and then their EMR vendor Healthland as well. One-on-one planning and training sessions, like I was mentioning that Leslie did. And then at the elbow support, they said was very important. When they went live with their ambulatory system, they had a full-time dedicated FTE to help answer those questions right at the elbow for the providers. And again, also stop any kind of practice that's maybe not so desirable with the electronic health record system, and negativity. If there were negative comments or, you know, I'm not going to use this, that spreads really quickly. So if you can stop that right at the point that it's happening, that's the best practice. Another thing that I hear Glacial does really well is celebrate. And you can see that. They've got all the fun Halloween stuff today in their cafeteria. But they like to celebrate about once a quarter. And so whether it was having a baseball kind of theme, I hear you guys did some things around that, and gave away Twins tickets as kind of the grand prize. Or or using other kind of celebrations. You have to celebrate along the way. Any kind of little thing that you can celebrate really helps to keep that positivity and focus on what you're doing. So just a little bit about the timeline then. Glacial signed their SLA, their contract with REACH back in October 5th of 2010. And just notice how quick this timeline was. They started their 90-day reporting April 1st of 2011, so April, May, June, I think July 1 you guys ended. And they successfully attested August 4th. And so that's another thing that Heidi always tells me. You know, we have a timeline, we stick to it. If things come up that are out of our control, we do what we can around it and just keep moving right along. So I thought it was pretty cool. I went to your website last week, and right up there up front in your About section, you have marked that you have met stage 1 meaningful use. And there are many organizations, large organizations in the Twin Cities that don't even know what's going on. Their leadership knows, but their clinical staff has no idea. So I think this is just a huge testament to how engaged everybody is here and how important this goal was to you. And then Heidi has this awesome poem that she likes to use as well, just about hanging in there and not quitting. And she said, you know, sometimes you folks have other Healthland users come and visit you who are just saying, we're ready to cash it in, we don't want to do this anymore. And Heidi says, why would you quit now? You've come so far, you have to keep going. So that's all I had. Any questions?
Thanks, Sarah.
Sure.
Now we get to hear from the real experts. Kirsten Zerud is the CEO here at Glacial Health Systems, and Heidi Engel is the CIO at Glacial Ridge Health Systems. I think what's remarkable is we have the vantage point of looking at 83 different critical access hospitals in their journey to meaningful use in Minnesota and North Dakota. And I always look at Glacial Ridge, they are barrier busters. No barrier is too wide for them to overcome and get through. And I think it's things like the poem that Heidi has about don't quit that brings the team, Leslie and Darlene, through redesigning workflow 27 times or whatever to make sure the goal is achieved. So Heidi and Kirk.
Thank you. Thank you for everybody coming today. It really means a lot to us to have you here. Even a Green Bay Packer fan. We really do appreciate it. And you know, we're big on celebration, and it really helps to have people recognize all of the work that's gone into getting to this point. And we do have a lot of work yet to go. There's no question about that. But you know, back in 2006, we made as an organization a commitment that we were going to be leaders for our size facilities with electronic health records and the implementation. And back then we set up a timeline and with milestones that we wanted to reach, and we kept revising that timeline and adding things on as we met new milestones. And for the most part, we keep meeting our goals. And you know, the presentation that Sarah just gave really identified a lot of the key points that were really important for us to implement. And you know, we just couldn't do it without, and it's this whole second row is kind of our key members here, and their commitment, and then all the staff within the organization that have to be willing to make the change. And when I say all the staff, I mean all the staff. You know, you might wonder, well, what does a maintenance department have to do with implementing an EMR? Well, when nursing decides, let's put the computers mounted on the wall here, and then a month later they say, that doesn't work, let's move it over here. That's maintenance. And then environmental services has to deal with cleaning protocols and procedures with all the computers in all the new places. And I think in 2006 we had about 14 workstations in our organization, and now we're over 200. I know that. So it's been a big change. Having the physicians involved is key early on during the education portion, which is what we started with in 2006. The very first thing is learning about EMRs and having them involved, and bringing in people to educate us like Dr. Kleber. And then just keep pushing along. And like I said, we couldn't do it without staff with an excellent attitude, leaders in our second row here with their attitude, process maps. Leslie, you know, I go to these meetings and we start talking about something that's not working right, and everybody can tell that I'm going to pretty soon say, sounds like we need a new process map. And they know it's coming, and Leslie has to sigh. But it's very important. And the communication. People need to know why it's important. And for us, why it was important is for patient experience and quality of care. We really knew early on it wasn't about saving us any money. It's not going to save trees. It actually at first kills more trees because all of a sudden you have all these new reports and information and you can print it out and so forth. And then a partner like Healthland that we started with Dairyland, and then they were purchased and now it's Healthland, and we've called on them a lot. I know Leslie especially has frequent communication when we need things tweaked just a little bit so we can get the reports that we need for meaningful use and so forth. That's very important as well. And what we have coming up is a major conversion. No, I'm not supposed to say conversion. Migration. I got scolded last week for saying conversion. So a migration to the Healthland centric system, which we're really looking forward to, but it'll be a lot of work for us to get ready in the meantime, and a lot of new process changes, but we really think it'll streamline our use of the system. Heidi, do you have anything to add?
Yeah, I just want to say thank you to this team in the middle. Jenna, Julie, Jamie, Leslie, Darlene, Jeanette, Lynn, and Kyle for getting us the money. Kurt, myself, we did an awesome job, and thank you, congratulations. I didn't really have anything to do with the hard work on the floor, but it was the nurses. You guys did really good. Thank you. We have goodies for you as well up here, so don't leave without getting those.
Yeah. Does anybody have any questions for us?
Please no.
And Sarah mentioned the goodies in the cafeteria. Stop by and grab something there. There's some kitty litter cake. I don't know who came up with that.
There's some quite unusual things, like if you ever wanted to eat a finger, there's some edible fingers. So we're going to have Paul come up and present some pins to the team.
Someone's going to.
Yeah, Heidi.
Oh, okay.
To name off some members.
Sorry. Are we ready?
So, yeah, we're ready.
Okay. Jenna Bryce.
What we're presenting today is because you folks have been so good at adopting electronic health records, you get these pins called meaningful users. It's called movers, Meaningful Use Vanguard Group. It really means that you're at the forefront of doing this. And that's ONC's way, the Office of National Coordinator's way of saying you've done a great job and you should be proud for what you've done. So congratulations.
Julie.
Here you go, Julie. Congratulations.
Jamie.
Congratulations, Jamie.
Thank you.
There you go.
Leslie.
She won.
He's giving up.
Leslie, congratulations.
Darlene.
Aren't we going to have Leslie give a little talk?
I think so.
Congratulations, Darlene.
Jeanette?
Congratulations.
Thank you. Lynn? Thank you. We'll share. Thank you.
Now we're gonna, if you just want to stay there, and we're gonna have Sally Buck come up. We have a certificate that we're going to present.
This is given to Glacial Ridge Health System, honoring our first REACH critical access hospital in Minnesota to achieve meaningful use of their electronic health record system.
Thank you.
Thank you. And also we have official certificate assigned by the head of the Office of the National Coordinator for Zod Mudasari. You can replace our certificate with Down to the wire, Glacial Ridge Health System just received their incentive payment last Thursday, so it was very close in how we setting this event and celebration and receiving their certificate. Congratulations.
Thanks.
Thank you.
So in conclusion, I stand before you with pizza. And so we just want to sincerely congratulate the Glacial Ridge Health System on their huge accomplishment. This is just spectacular. I think we could predict that you were on this path. We knew you had the infrastructure to do it and the team to do it, so we congratulate you for this accomplishment. And let's have pizza.
Thank you.
Thanks.
Thank you.